thank you for joining us. My name is Dr. Heather Strah. I am the medical director of the lung transplant program here at Nebraska Medicine. Last spring, when I met Donna Jacobsen for the first time, Donna was very sick and was battling idiopathic pulmonary fibrosis, a disease that causes scarring of the lungs. Her oxygen needs were going up. She wasn't able to walk very far, and she was getting worse pretty quickly. We were worried that Donna wouldn't be able to wait for a lung transplant here at Nebraska Medicine, but she was determined to be transplanted close to home, even though there were other programs that definitely could have transplanted her sooner. Just before Thanksgiving, Donna's name was the first one to be added to the lung transplant waiting list, and on January 26th, Donna became our second patient to undergo a lung transplant just 2 days after our first. I'll turn things over to Dr. Siddique, our surgical director, and he can talk about Donna's operation.
Thanks, Dr. Strah. So Donna's procedure happened just 2 days after our first lung transplant, which was a bit of a surprise for us, but not unusual. For some reason, transplants do tend to happen in clusters. Obviously, we were very excited. Donna had a single lung transplant, and that started around 1:30 a.m. on Tuesday, January the 22nd, and it lasted approximately 4 to 5 hours. The surgery went well. There were no particular complications, and of course, we were very pleased with that. As a nurse for over 40 years, Donna knows the importance of taking good care of herself, and she's done that fantastically since the operation. She's followed every instruction and has done remarkably well. After surgery, Donna spent 3 weeks in the hospital, and then since then she's been undergoing pulmonary rehab, which is a daily session, and she's now on track to moving back home at the end of this month. But in order to graduate from pulmonary rehab, we've asked Donna to do something very special. And this Saturday, she's going to walk 1 mile in the Donate Life Nebraska 5K race and Heroes Walk. So this is a wonderful event. It happens every April during Donate Life Month. And it's the purpose is to raise awareness about organ donation, honor transplant patients, donors, and their families, and it's a great opportunity for providers, recipients, donor families all to get together, and also an opportunity for people who are not aware of the process of organ donation to become more aware of that. Donna is going to be joined by her husband, 3 children and grandchildren tomorrow, and we're very, very pleased that Donna and Randy are with us today to take questions from you.
Okay.
Donna, do you just want to tell us how grateful you are and how your care was here at Nebraska Medicine?
I don't think there's words to describe it. It was fantastic. I don't know what I expected, but I was so pleasantly surprised that the pain was very minimal. The doctors were fantastic. The staff, the nurses were fantastic. The support team was awesome. Everybody, I can't think of one person that I wouldn't take home with me. You know, they were just unbelievable. The people down here are brilliant. Why would you go any place when Nebraska has a facility like the Med Center? I can't say enough about it. They have been amazing. I'd like to thank my family, my husband, for being there for me. What a journey.
Talk about how sick you were, like how you felt before, and now how you feel today.
Oh, I was basically, I could do nothing. Pretty much, I was very deconditioned, and my son and his wife and my other children as well. He's a therapist and so is she, and they insisted that I do some sort of rehab. And then when Dr. Strah said, yes, you need to be in pulmonary rehab, that was the kicker. And as much it was as difficult as it was, I did it. And I supposedly graduated from that program, but then I kept going maintenance just to keep what I had gained. And then shortly after that, Bobby, the coordinator, I believe, she called me on a Monday morning at 9 o'clock and said, I think we have a lung for you. And then we just kind of went into shock mode. It's like, okay. I looked at him and he looked at me and it's like, oh my goodness, here we go. Called my daughter, she contacted my kids, they dropped everything, left their jobs, met us in Wisner, Nebraska, headed for Omaha, got here, and from the time we got into the towers and checked in, I really have no clear memory of anything until probably a week afterwards. So, but they were there the whole time. I couldn't have asked for better support.
When you first started this entire process, did you think you'd be able to walk an entire mile and to do what you're going to be doing tomorrow?
It is just so nice not to pull a concentrator and suck air. Yeah, it's amazing. I had to kind of relearn to breathe because, you know, when you're constantly breathing through a nose cannula, you know, it's different. It's like, no, wait, I got to breathe different now. So it's taken a while, but the therapy at first was very intense, or not intense, but I didn't know if I could do it. It's, you know, it's very difficult, basically. But as I went, Peggy from the rehab department is amazing, and she was very kind, but she kept me going, and now it's a piece of cake. So, yeah, it's the whole team, from the pharmacist to the brilliant doctors, and yeah, it's been a very pleasant experience. It has. Nothing like I expected.
What's next for you after this?
Go home. I went from being a registered nurse to being forced to retire and on oxygen, so I don't even know what normal is. I'm going to have to figure that out. But I think it'll come. So, little by little, I'm not going to tear my house apart now and try to do everything that I haven't done for 3 years. Little by little. So.
Tell them what you told me about your pain levels when you were here, how you compared it to something else.
I would rather have a lung transplant than have a baby. The pain, they never let my pain. Tylenol was basically all I took. I don't know what he did, I don't know what they did, but, and I was told that when the epidural with the numbing ingredient came out, that the pain would probably get a little worse. It never did. I just took Tylenol, and that was a very pleasant surprise. I don't know what he did, but he did something that fixed it really good. So there was basically no pain. The tubes, drainage tubes, last a little longer than I expected, but I didn't want them taken out and then put back in, so. And that worked too. So they know what they're doing. And if you're contemplating, come to the med center, talk to these people, and do exactly what they tell you to do. Exactly. From treatment, taking your medications exactly when you're supposed to. That's the key, as far as I'm concerned.
Well, Dr. Strah, Dr. Siddique, I mean, you're dealing with a nurse. Was that a little bit different than other patients who kind of don't know some of the, regular technology and
I certainly didn't intimidate them. No way.
So working with Donna has been amazing because I spend a lot of my time trying to think of how to explain things, and because Donna was the first person that we put on the list, it was a lot easier to explain everything. We got to practice on Donna and
Yeah.
work on our patient education with Donna, and it was really fantastic.
Well, Dr. Siddique, you were in the OR a lot those 2 days because we had Phil's transplant 2 days before Donna's. How was that for you, having to, your first two, just back to back pretty much?
I mean, it's kind of exciting. I mean, it's you know, people in the transplant business sort of recognize that it always seems to be clusters for whatever reason. I don't know why that is, and so it's not unusual. But obviously, it was really exciting for us to get the program off to a good start and have two operations go well in a short period of time. So we were pumped, I guess.
And I have to thank my husband. He's been a rock. He's been there for me. He's made sure you've taken your pills. Yes. It's time to go. Yes. You know, he's kept me on track. He's been my secretary. So.
Randy, how was it for you to see your wife go through all this, but keep such a positive disposition and seem to just come through so well?
Well, she's a dedicated person. She's strong. She's had other surgeries. She's come back from them. She's did really well with this. She never complained about pain. It's just amazing. This is a miracle situation to me.
Yeah. He didn't go through the physical part of it, but I think he went through the emotional part of it. Like my family. But I don't think they missed a week since we've been down here. Somebody has been here, and that is so comforting. And I have a brother and his wife who have taken care of our place and made sure our mail got here every week, and you know, they've been amazing as well. So yeah, a lot of good friends, neighbors, visits, cards, letters, you know, words of encouragement. And I think you really have to have something spiritual to hold on to get through this.
This is Donate Life Month.
Mhm.
What do you guys want to say to encourage people to become organ donors if they're not already?
Yeah. From my experience, had the donor family not been generous and kind and thoughtful, I wouldn't be here. I know I wouldn't be here. So, these guys, and I had another pulmonologist, a Dr. Lee Morrow, and he was fantastic. He met with Dr. Siddique and Dr. Heather when they heard that the transplant program was getting off the ground. And when he came back and talked to me, he said, you know what, you need to be with them. You know, and so he made the referral, I believe, right before she went on a medical leave. And I'm so thankful. Oh, I'll never be able to thank him enough as well. So.
And you guys come from a small town, so you must be the talk of the town these days.
I hope not. I'm kind of a private person. I don't like to be in the spotlight, so to speak. I kind of like to cower in the background, and so this is really unusual for me. But after everything they've done for me, I could not ever say no. So, because they have given me a new birthday, January 26th. So, and I will be back. I will be back periodically. Got to see those babies. So, and hopefully tomorrow I get to meet them. I feel like I've known them since birth, only by pictures, but yeah. And I got to see his children today too, and beautiful children. And they'll grow up to be wonderful children.
Thank you.
So
I guess since you have this new kind of freedom, have you, during the time that you were sick, did you come up with any lists of things that you wanted to do?
I just want to be a housewife. I'm retired now. I'm not going back to nursing. I was at that for over 40 years, and the technology has way surpassed what I feel like I could do, and I've given it a lot of years, and I'm ready to let the young people take over. So, and they're brilliant. I just can't imagine in 22 years, or some of these nurses, how they can know so much. And these people are like 28, maybe, and I don't know how their brains can hold all the knowledge that they have. It's just wow, incredible, fantastic. I can't say anything else. The whole team. Heidi, I've been working with in the pharmacy, and she's amazing as well. And I'm afraid I'm going to forget somebody if I try to start naming people, but the whole team has been wonderful.